Hello all and welcome to another edition of What's News in Healthcare Social Media. I'm Kathy Brown of Brown Nose Social Media, and I have to tell you I was holding my breath to see if we would even have a show today. I had all kinds of connectivity problems, so I apologize for getting off to a late start, but I assure you we're still going to pack lots of good, helpful information into this. Today's guest that I have with me is Alex Basinger. Alex Basinger is one of the writers for Social Media Examiner, and we featured one of his articles last week on Twitter Analytics. And I'd like to introduce Alex now so he can say hello to everyone. Alex, would you like to say hello?
Hi everyone, I'm Alex. Sorry for jinxing your perfect run, Kathy, but thank you for having me on the show. I'm glad we could work through the difficulties and have a great conversation.
I love that you're starting off the day with coffee. I had 3 cups before we got started, so this one ought to go really fast. So we got a little bit of our feathers ruffled here trying to get things off to a good start. So I want to dive right in because we've got a lot to cover. I'm going to be a little bit disheveled today because I've got 2 separate computers that I'm working with. But I'd like to start out by talking about the article that is found in, let's see what, Social Media Today. And it is called Social Startups, Help Around Lets Healthcare Providers, Brands, and Retailers in on the Diabetes Patient Discussion. And I think this is really a great article to read when you look at it from the perspective of creating communities where patients can go and get information, and what's the return on investment in either creating or participating in these communities. Did you get a chance to take a look at this article?
Yeah, absolutely.
So let me ask you a question from a patient standpoint. Have you been involved in any community building with patients, or have you been, from a healthcare standpoint, ever been a part or tapped into a community that was around a healthcare need?
I've definitely tapped in the communities. I work, for my 8 to 5, I work with publishing. So education publishing is my big day-to-day. So I haven't really done in the healthcare community work from the standpoint of being the person behind the scenes, but I've definitely been a patient. I'm the type of patient where I don't want to go to a doctor or even really a hospital unless they're texting me and emailing me. You know, I'm a very high maintenance 21st century patient. So I'm probably a good example of someone that this article is talking about. And for me, what really struck, what I was thinking about when I was thinking about this article is, what are you going to do to actually make it convenient for me to log into this on a daily basis? And what popped into my mind was actually my bank app, Chase Bank. They somehow get me to use that app every day because it's so useful. So what sort of utility are you going to offer from a healthcare standpoint is I think the starting question, and one that I'm interested, in hearing.
Yes, so you're referring to the patient portal, and I think that's interesting because we're all trying to move patients into a patient portal and find out what that value is. And I think it's interesting that this article points out that in people that found a valuable community to be a part of, whether it's private community or a public community, in this case I think the study was looking at public communities, that they probably had a lot more resources to tap into. But if you can have or provide a community, the people who were a part of those communities spent 19% more time with that business. And I think that's an important point to make to administrators who might be deciding how much money to put into a marketing budget or how much time should be spent on community building or monitoring or participating in a community or even building a community inside the patient portal, because that 19% can really amount to having additional office visits for the physicians within your system as opposed to the competition. And the article also talked about trust, and I know that even in general business, when you're looking to buy, like I shopped for a Cocoon, little sleeper insert for when you go traveling, so you have your own little bed with you wherever you go. And I found when I was looking for this product and trying to determine what material and what company, I looked at other people's reviews, and that significantly swayed my decision on where I went to do my business. And this article talks about that too.
And I think it's important for whatever your brand is. It's important for you to also engage where not just it's great to create a forum, create a blog where conversations brought to you, but you also need to be going on LinkedIn groups. You need to be going on, if it applies, Reddit, subreddits, finding the subreddit that has to do with urination health or whatever it may be, and engaging in those conversations. Because if you just set up your own forum and say, hey, come have a conversation, come have a community, that's still, in this day and age, everyone has a forum, everyone has a blog, that still seems self-serving. So when launching, if you're launching a new forum or blog, you need to start that by going and branching out to where the conversation's already happening and being a part, having your brand be a part of that conversation. So again, that's LinkedIn, Twitter, Reddit, Google+, whatever, wherever that conversation is happening, but you need to do a hunt and find it.
Good point, because this article also talks about the value of having people find value in the community, and tapping into peers is that there's actually a positive improvement in the medical outcomes of those patients. So as we're talking about all the articles, and we're going to move on now, but I want to make a couple of points. There are some facts to consider if you're looking to participate in a community or specifically provide a community, and that is answer the question, how will patients benefit? You have to be able to answer that question and communicate that to patients in order to get them to come, so they know exactly what they're getting from it and they find benefit from it. And also, you want to make sure that you want to know how patients will remember that you're the one who helped. So if you're not going to create your own patient portal community and you're looking to participate in, let's say, a Google Plus community, then you want to make sure that the conversations that you're having in that community are going to identify you as the helper. There are some new communities that are popping up, and this article talks about Help Around, which is a specific community around diabetes. There's another one that I saw an article on, and I don't remember the name of that one. But what you want to look at is if you're going to participate in those communities and offer information and help to patients, you want to make sure that your brand is visible when you do that, and that they're going to remember it came from you, and it doesn't just get lost in a very cumbersome social site. And then the last thing is, can you target your audience by location? And that's really important, because if you're joining some of these groups and you don't have a way to target the people that you serve, you're just spending a lot of time giving away free information, which is okay if you're building your brand and you're building your SEO visibility. But if these private sites don't offer that, you might be not putting your time wisely into the right places. Okay, you ready to go on to the next article?
Keep moving.
Okay, I really liked this article. It's by Kissmetrics, and it has a whole series of ways to use Google Plus most effectively and some specific tips. And I really liked this article because I thought that it highlighted a lot of really good tips. For one, it talks about the personal profile and how important a personal profile is. And I know that you interact with people a lot on Google Plus through your personal profile. Do you have a business profile as well?
We do have a bit. I do have a business profile for a couple different businesses, and it's definitely definitely a challenge. I don't really do anything with Google Plus. I'm not very active as an individual, and people just tag me, and it just happens. But with the business, it doesn't just happen. You have to really grind and work at it. So there's definitely the advantage to using that personal profile.
Well, first of all, we will forgive you for not using Google Plus more, but eventually I'm going to convert you.
I'm a big Twitter and Instagram guy, but I'm learning. I'm learning the G Plus.
Well, as far as the personal profile, what I want to discuss here is how important it is to have personal profiles, because people connect with people. They don't connect with businesses, hospitals, health organizations. Eventually they will, if they think that you're providing information, but they're not going to really engage until they like the people behind the organization. By encouraging your physicians and your marketing staff to have personal profiles and giving them some guidance on how to engage and not engage, that gives you a lot more exposure through the faces that represent your organization. And with a good social media policy, you don't have to worry too much about how people are engaging. But it is important to have those personal profiles, so when someone's talking about diabetes, like in Help, I forget the name already, or in a community, that the physicians' profiles are able to go out and say, you might want to make an appointment with your physician. If I notice that you're in our area, you can always make an appointment with my office, but you should probably get that seen. That's not giving healthcare advice, but it is reeling people in and giving them good advice and guiding them into the business with a face behind it. Did you look at this article? Were there any that were your favorites? Or you said you don't use Google Plus a lot, but you use Google Plus some, right?
These apply. I mean, I think some of these are more universal social media theories that are really applicable, like changing your hashtags, just change, and choosing a time. Like the times and the hashtags and the way you're writing needs to change for every platform you're on. Even if you're sending the same link, even if we're advertising this hangout, we're going to advertise it different on every single platform. And I love seeing that everywhere, because the thing I hate most in the world is Twitter and Facebook connectivity. Like when you can tell someone's Facebook page is just posting their tweets, or even worse, when their Twitter feed it starts and says ... and you see it's an FB link. And you're like, why are you showing me 8 words from your Facebook? Like, I'm not going to click on that on Twitter. So really understanding which platform, choosing the platforms that work best for you. So if it's Google Plus, finding out how to create the best content on Google Plus and using the hashtags that are there, not the ones that work on Twitter. I love saying that anywhere, and that's what definitely made me the happiest on that list. But it's a great list.
Well, I'll tell you, one of the things that I think is really unique about Google Plus, and this article points it out, and that's the point number 2 of posting microblogs. When I first joined Google Plus and I was learning how to use it, I noticed that there was a lot more verbiage capability than with the 140 characters of Twitter. And of course, I had felt stifled for so long that I just had to let loose, and I would write these little micro blogs, and I didn't even write on my own blog for a while. And I really got a lot of traffic and engagement and attention, and I have not done that as much as I should. I should go back to doing that a little bit, because having that individual content and really giving people something to read right there on Google+, and then you can always link to additional articles that give more information. But those microblogs are really a unique personality of Google+, I think.
Yeah, absolutely. They're in its own unique way. We're seeing that on LinkedIn as well, with the LinkedIn-based blogs. Would be the one other place I've seen anything like that, where you have people creating content just for that social platform. And I did. This enlightened me, because I was able to click around and see some examples I really liked through this article. And you might be converting me to Google Plus. This might be. We might look back in 2 years and say, this is when Alex Basinger really turned his leaf.
Well, then we'll have to have a 1-year reunion and see how it works for you.
Oh, absolutely. Challenge accepted. Yeah, absolutely.
So one of the points here on number 4 is engage, and I'm not going to spend a lot of time on that, because anybody who watches my shows regularly knows that one of the key ingredients to Google Plus being the most effective platform is to engage, because that really does significantly impact your visibility the more you engage, and that is engagement through +1s and through comments and through getting circled and having other people circle you and sharing videos and all of those things. Hashtags help people find you. Any way you can engage with people, that's really important. There were some things in the article, though, that I thought I would put a little caution to, especially since this is healthcare. One of them mentions call people out by name, mention them in articles. That's okay if you're citing a medical resource and you want to cite a medical resource profile. I think you need to flag that one and make a mental note, though, that if you're talking to somebody or you're talking about a situation, you don't ever want to flag a person who is a patient or a potential patient, because that could be seen as a HIPAA violation, especially if that in some way tells people that that person is an existing patient and that wasn't something that was already offered in the social space. So you do need to read through these with a special eye for HIPAA compliance, and any place where you would normally think that they're talking about speaking directly to a patient about a topic, don't do that. And I think that's pretty common sense for any of our viewers here. But I just want to say that in case somebody finds the video later and they're not quite as savvy with that. One thing that I wanted to mention, this article also highlights one of the other important parts about Google+, and that is having Hangouts on air like we're having, and having events, posting events, physical events, virtual events, and all those. But one of the other things is to ask for +1s. The article says ask people to reshare it, ask people to +1. I have my own idea of how that would work brilliantly in healthcare, but I'd like to know from you, Alex, do you have any specific suggestion of a case where you could post something as a hospital and successfully get people to want to +1 it?
I have more experience on Facebook and Twitter with this, so that's where I'll kind of go. But as far as liking or retweeting or any sort of action where you ask people to promote for you, just nothing where it seems like you're trying to sell. So if you're having an event, a free event, +1. If you are here's our blog of the week. Don't beg for every blog to be +1, but maybe one a week. So here's our blog of the week, our resource of the week. Please +1 this and share it. Another thing would be if you do have a new portal or a resource, anything that is really content based. Let's say you can. It seems like asking for a +1, asking for a like, asking for a share is intuitive in that sort of action. If I don't work in hospitals, so I don't know what this would equate to, but if I'm trying to sell a book, I'm not going to say, I have a new book, you can buy a +1 this. I might say, I'm really, really happy to be an author and feel really appreciated to have this support. Please +1 this to share, my enthusiasm with the world. Maybe something like that. But so I think there's a line of, do you sound like you're begging for a sales pitch, or are you trying to get people, like a community around your thoughts and your ideas, if that makes sense?
Well, I'm gonna take this to the next level, because I'm going to admit that when people ask me to reshare and +1, I usually don't.
Oh, I don't. No.
You're right. There's that desperation, and that's a very awkward. Oh, +1 this. Be sure and reshare. Be sure to circle us at such and such. Yeah, I don't have the time to do that, and it's not my job to +1 people. However, when people appeal to my emotional and guttural response, I do +1. I do reshare. So the way I see this working to the advantage of healthcare professionals is to pick a topic that people are passionate about. It might be weight loss. It might be smoking, quit smoking. It might be breast cancer survival. Whatever the particular topic is, especially if it's worked around a particular event like Breast Cancer Month or smoking. There's usually one day that you give up cigarettes. If you post something about that and then have a call to action, if you have quit smoking, if you were a smoker and you quit, +1 this. Or if you are a smoker and you'd like to quit smoking, +1 this. Because that will flag for you those people who want to quit smoking or want to lose weight or want to whatever it is you've identified them as. And you may have just identified people that you can specifically engage with and get them into your healthcare setting. Okay, so we're running out of time, so let's move on. The last two are going to talk about social media policy, the do's and the don'ts. He's laughing because he knows where I'm going with this. Union Street Guest House, shame on you. I cannot believe you are going to bill the bride and groom $500 fines for every guest that posted a negative social media comment on Yelp. I cannot believe anybody thought that was a good idea. All right, I want your thoughts on this really quickly, Alex.
This is a sort of situation where I imagine maybe the social media manager or web manager is like a gremlin in the dark cave because they clearly don't understand how the internet works. And if you have bad reviews are just a thing that happens. If someone's disgruntled, they're going to say it. And now they're going to do it on social media. They might be doing it on their Facebook page. I just got married. We are on Offbeat Bride all the time. And there's all sorts of other wedding websites where the bride and groom are going to say, this was awful. and other people, other brides and grooms are going to, so the conversation is going to happen. You don't need to have a negative reaction to the review. You need to try to turn a bad review into a good conversation. So, because at least half of bad reviews, people are just trying to be heard. And when you engage with them, you can very quickly usually sort out. They say, oh, I didn't know this is why X happened, or this is why it didn't quite occur the way I wanted it to. So it really stuns me that they didn't try to engage with the bad reviews. They just said, we're going to fine you $500. That's They made it even worse.
Yeah, and when they said they were going to fine the wedding couple when someone else posted a comment, that is like kicking the puppy. So
yes. Yeah, absolutely.
And I went back to the Yelp pages, and I saw that there was a comment that there had been over 800 negative comments that had been removed from people who could not prove that they'd actually been staying there. And that's one of the policies of Yelp, is you have to actually have been a patron there to make the comment. And people were just so angry, they were going out and posting without staying there. But it goes to show that you can get people angry and passionate about something negative much easier than something positive. However, let's talk about social media policies that do work. There is another article that I just love, and it is by Hospital Impact. It's called How Hospitals Help People Through Social Media. Nancy Cowley-Jean is the author, and she talks about how social media is actually a powerful tool to leave a positive impression even when people start out with a complaint. And this is worth a read. She covers both Twitter and Facebook, and she gives two examples that I think are really good examples to share with those decision makers who are maybe holding you back from getting into social media. In the first example, she talks about there was a woman who had filed a complaint. She was making a comment on Twitter, a tweet, that her friend who was in the hospital was not getting the service that they needed. And she made that post, and the hospital then responded with what they were able to do, where they were able to go to get that fixed. What do you think about that?
I think that's great. There's a book called No BS Social Media, and that book it makes a lot of wonderful points, but it makes a really wonderful point that as far as customer service goes, that conversation is happening on Twitter or Facebook, whether or not you're engaging with it. So I just really always love hearing examples of people sort of turning that around. I don't understand why you want to be on Facebook or Twitter at least for customer service purposes, because it makes so much sense.
Well, and that's a perfect place to reach out to people and to get something done and to give the impression that you really care. And that's the difference. The first story we talked about was definitely the impression of we don't care. But reaching out to people and unprovoked. A lot of people who put things on Twitter never think someone's listening. It's really just to get other people as riled up as they are. And when someone is listening and they respond and say, we want to fix this, here's the number to call, here's the place to go. I do think I want to urge people, if you're going to use this for customer service, to make sure you follow up behind the scenes so that when that person makes that phone call, that they know that phone call might be coming in and they respond to that appropriately, because you can really mess things up if you send them to a place to get help and then they do follow that and it's even worse and they don't get help. So the other example that Nancy mentioned was a case on Facebook, and we talked about one like this before, where on Facebook you have to think about the different demographics and the different social sites. And Facebook has been either the younger kids who aren't mobile yet, don't drive, or the elderly, retired people, and stay-at-home moms. Twitter gets to be a little bit more of the older age range, sometimes the working or the mobile people. So when you look at Facebook, in this case, she talks about somebody who reached out and they posted that their friend was thinking about suicide. And they were able to respond to that suicide with prevention and let people know that this was a great way to help others who need that help. And what a great message. I just think that's a great message. Well, this is the time we normally would have invited people to come in and join us. And we're not going to be able to do that today because of all the issues that I had with launching the Hangout. I have a very strange URL that I don't, well, I can try it. We'll see what happens. I'm going to post the link onto the event page, and we'll see if anybody comes in. I'm not sure how that'll work or not. So if you'd like to come in and chat with us for a few minutes and ask me or Alex a question, follow that link. I think it will work. I'm really not sure. Like I said, I had to launch this Hangout a different way, so I have a rather strange Hangout link. But I think we had some great topics to talk about today, Alex, especially with the social media policies. Let's talk about the policies in general. I know that healthcare has some specific things about patient privacy. But when you're talking with someone and you're giving them advice on how to start a social media policy for a company, what are some of the highlights that you tell people to make sure they include?
I mean, the thing I would start with is it's hard to put into words. Your employees, no matter what they do or don't say, they're tied. They're going to be saying it whether or not they're tied to your company. So having them tied to your company is just a benefit for you. I would say to keep it as simple as possible. So you have 5 or 10 guidelines that you can give to any employee that wants to get involved. And then I would also say that after your social media expert is crafting whatever is the best policy for you, they or someone else familiar is acting as a guide to sort of initiate any interested employees into being involved. So that can be an employee advocacy team. That could be something a little more broad than that. But I would definitely, I think if you create a group mentality around it and you have your social media expert on site helping people through, you kind of create this community environment of learning the process, and thus people are less likely to do something that would be outside of the company's interest. Because if they're doing something that's outside of the company's interest, it's usually because they don't know better. It's not because they hate where they work or something like that. It's usually just that they didn't know better to not post a specific, not post X or not post Y. So yeah, that's what I would say.
Well, and also it's good to maybe yearly have a little pep rally. I'm not talking about a large meeting where you're taking everybody away from their work, but even if it's just as simple touch bases with your monthly newsletters, or maybe a once a year, just reminding people, telling some good stories of success so people understand what works for you in social media and what doesn't work for you in social media, and they get on board as a team. Before we wrap up, we have some people that are joining. Wayne, say hello, Wayne. I put you on the screen.
Good morning, everybody. How you doing?
Thank you for joining us. Did you have any comments or questions from today's discussion?
No, this discussion can actually probably go on all day long. But no, I appreciate you guys taking the time to actually talk about social media and how we can use it effectively. You know, I'm having a lot of questions personally because I am a nurse and I work at the hospital, and everybody sees what I'm doing on social media, and I'm just trying to enlighten everybody, just like you guys. So I appreciate it, Kathy, and you know, I just look forward to seeing some more of your shows.
Well, since I have you here, and you mentioned that you are a nurse, how are you working for an organization that is using social media in a positive way, or are you still trying to get them on board with that?
I would say, are they using it in an effective way? Basically, they're just kind of I feel like it's invasive advertisement more than what they're trying to do. And what I mean by that, it's the same things that you can see in the newspaper is pretty much what they're putting on social media. And I don't think that does the same thing as far as maybe even just saying, hey guys, look what we put into the newspaper or something like that, and trying to say, what do you think about it? Plus this, if you'd like us to contact you, or be on our guest list, or you know, that sort of thing. There's just no interaction, and I'm starting to try and wonder why that is. Is it just because it's the old advertisers that do not want to chase this rabbit, like I've been told by my marketer? And I really just think they can't put the number into an Excel spreadsheet as far as what the return on investment is. And I keep telling them that you're not going to see that number for a while, right? But it's more to it than that. And what kind of number can you put on a billboard is my argument. You know, they have these big billboards that they keep placing across town. And I understand there's thousands of people that drive by it, but how many people have actually went to the hospital because I said I saw your billboard, right? And you know, this is things that we can engage and change on a daily basis. And if you get enough people following you as a hospital, you can even put out mass alerts. You know, flu season's coming around, that sort of thing. It doesn't have to promote the hospital. You can actually just promote the health, is which I keep hinting to the hospital. You know, promote the education to where you're not telling people what to do. You're helping them get an informed choice, and they're going to remember who the one's informing them. That sort of thing. That's my take.
Well, I'll tell you, there's one place where you can have a measurable return on investment, but it does take a little bit of time. The people that I've talked to in a hospital environment who are in charge of marketing and who are resistant to getting out in the social world and doing exactly what you're talking about, taking the same things they have on the newspaper and posting them on the website and sharing them on Twitter and posting them on their Facebook page, those are the people who are afraid to engage. They are truly afraid because they don't know what they'll do if they get a negative response. And that's one of the first things you have to be able to do, is have a plan of what happens when someone says, I had an awful visit, or you left me sit in an operating or in an office for so long, or my family member died. Once you have an answer to that and you remove that fear, the return on investment that is a measurable return on investment for any engaging entity is the search engine optimization, the search engine results. If they will go out and they will engage, not broadcast, but engage, within 3 months you should see from where you were on the search engine results, you should start climbing up in those words that you were using in your content that you shared, if you have good content. Within 6 months, you should rock the house. If you have not moved to one of the highest positions within 6 months by engaging, especially in Google Plus and on YouTube, because videos, they just seem to really impact more than anything, then you're not doing it correctly. But if you get out there, if an organization gets out there and engages, that is the #1 payoff that you can absolutely measure.
I agree. You're preaching to the choir, sister.
Okay, so whoever watches this later when it's recorded. Well, I wish there was a way to get that message to more people, because it is really frustrating to know what they're passing up simply because they don't want to engage. And the other complaint that I do hear a lot is they don't have the manpower. And I answer that with, you've got people who work for you who would gladly engage, just like you, Wayne. Yeah, he's out there waving. Yeah, because you want to evangelize for the people that you believe in and for the services you personally provide, and yet they seem to be afraid to empower you to do that. So if there was a way to communicate how to safely empower you to do that, that would be a great first step. And I have not figured out how to break through that when people are really resistant to empowering people beyond marketing to communicate a message. If anybody figures that out, share it. Well, we are coming to the end of our What's News in Healthcare social media show. We managed to get through all the topics despite our delayed start. And Wayne, thank you for joining us as one of the viewers in the audience. I hope that you'll continue to join us in future weeks to come.
Yeah, thank you.
And Alex, thank you for joining me as the social media co-host for today. And last week's article on Twitter Analytics really rocked, and I hope that sometime we'll have a chance to talk more about that.
Absolutely. Have me back anytime, Kathy. And I'll be back in for a year for my Google Plus intervention checkup.
That's right. That's right. And for all of you who watch on a regular basis or who are new and would like to start watching on a regular basis, if you didn't receive a notice, feel free to reach out to me and I will add you to my list so that it'll be on your calendar and you can say yay or nay every week. And next week, it will not be me. At least I don't think it will be me. I might try to work it out so it is, but I will be in India. I will be broadcasting the ASE, that is the American Society of Echocardiography Foundation's Values Program. They have a team of doctors and sonographers that will be going out there to treat adults with rheumatic heart disease, and they'll be having live case studies broadcast over the internet. So if you know anybody who's in cardiology who would like to see these things happening in real time and hear some of the interesting case studies, and they'll be using mHealth and talking about those tools as well, then follow my page, find out where that is, ask me if you can't find it. There is an event posted for that, and that's where I'll be. I'll be in India. So I look forward to coming back afterwards and sharing with all of you my experiences. And until then, this is the end of today's What's News in Healthcare Social Media. I'm Kathy Brown of Brown News Social Media. See you soon.